Many things determine your choice of treatments for fibroid: their size, symptoms, their type or locations, your preferences, and what is available to you. It can be difficult and confusing to sift through which method to use, but size is a significant consideration when trying to decide. So in this video, let's take a look at which treatments may suit particular sizes of fibroids. Hi everybody, welcome back to my channel. I'm Dr. Sylvia, a general practitioner and the founder of AskAwayHealth. If you're watching for the very first time, welcome. Please give this video a like and don't forget to subscribe to the channel if you want to learn all about women's health and everything to help you live healthier lives. Fibroids can be of varying sizes, growing from a few millimeters to several centimeters. Sometimes, to help in choosing the proper treatment, doctors may group fibroids according to their size. As you can see here, a small fibroid is about 2 centimeters or the size of a 4-week pregnancy. An average fibroid is between 2 and 6 centimeters, about the size of a 10 or 11-week pregnancy, while large fibroids usually measure more than 6 centimeters and are the size of 12 to 16 weeks pregnancy. Now, just for comparison, once a girl attains puberty because of hormone changes, her womb becomes pear-shaped, and the normal size of the womb is around the size of a woman's fist, and it weighs about 100 to 200 grams. Please remember, these terms are just for describing size, and being small or average or large alone doesn't indicate how severe the symptoms any fibroid can cause. It would also depend on its location and number as well as the size. The largest fibroid in the world weighed a record 140 pounds, about 63.5 kilograms, nearly the size of another human being. The womb is the smallest structure, labeled U. This came from a 37-year-old Indian woman who suffered from abdominal pain and swelling for about 3 years before she came to the attention of her doctors. Her fibroid measured 30 centimeters and she looked like she was about 7.5 months pregnant. So now let's talk about which options will best suit large fibroids. Number 1, surgery. Surgery would not be considered appropriate if a fibroid is around 3 centimeters or less and is not causing any symptoms. But if the fibroid is between 3 and 10 centimeters causing symptoms, it is reasonable to think about surgery. And the options are a myomectomy, that is removal of just the fibroids through small incisions placed in the abdomen, that's called a laparoscopy. You could also have an alternative to surgery known as uterine fibroid embolization, a method of killing a fibroid by shutting off its blood supply, which I discuss more in these videos here. For fibroids bigger than 10 centimeters, your options include an abdominal myomectomy, that is removal of just the fibroid but through cuts in which the abdomen is opened up to gain access to the womb, and that's known as a laparotomy. Suppose you have huge fibroids, especially those causing severe pressure symptoms. In that case, your doctor may consider whether a myomectomy or hysterectomy is appropriate. Hysterectomy is the term we use for removal of the entire womb. Your doctor may also consider this if you have several fibroids of moderate size bigger than 6 centimeters. Now, in most cases, you may be offered removal of the womb, that is a hysterectomy, if the symptoms are severe enough or the fibroids are growing very quickly. Having a lot of small fibroids may also mean a myomectomy can be impractical, and so a hysterectomy is a better option. Another instance where taking away the fibroids and the womb makes sense is if you want to be sure that the fibroids will not grow back, because yes, many times after treatment, whether it's a medical option or surgical alternative, fibroids have been known to grow back. Remember the lady we discussed initially whose fibroids weighed over 60 kilograms and looked 7.5 months pregnant? Well, she had an abdominal myomectomy. Interestingly, her womb size was normal and the surgeons were successful in removing just the fibroid. Large fibroids can also be treated with surgery alternatives like uterine fibroid embolization. Another option is radiofrequency ablation, which uses heat passed directly to the fibroids through a device passed via the abdomen while using an ultrasound scan to look into the womb. I do hope you're finding this video helpful. Please don't forget to give it a like and consider subscribing subscribing to my channel. Next, medical treatments usually help to control symptoms and they don't often affect the size of the fibroids. The exception to this is some hormones which are quite effective at shrinking the fibroids, but only for a short period of time, because once you stop taking the hormones, the fibroids start growing again. And so these hormones are used for shrinking the fibroids before surgery, helping to make your operation more manageable and less complicated. So how do we tackle small fibroids? Well, small fibroids may not cause symptoms, in which case we will leave them alone but continue to monitor them to check if they're growing or growing very quickly. However, if we need to treat them, endometrial ablation destroys the lining of the uterus, and this procedure is recommended for small fibroids less than 3 centimeters in diameter. It's important to say though that this procedure is not suitable if a woman is still trying to get pregnant, as fertility can be affected. Another option is radiofrequency ablation, which I've already described, and it can also come in as an option for a small or average fibroid. Medications like painkillers or birth control methods like the pill or the Mirena coil can help with bleeding problems from smaller fibroids. Now, what about natural treatments, including supplements like green tea, diet, castor oil treatments, and so on? Although they're a popular option, their use is not yet validated for shrinking or removing huge fibroids. Many of the effects they bring may benefit smaller or average size fibroids more than the large ones, especially if the large ones are causing troublesome symptoms or infertility. Some of these supplements or natural methods can help to control symptoms of pain and bleeding, but still, enough studies have not been done to demonstrate how effective they are. And another consideration is whether they will even work as well in premenopausal women, that is a woman who still wants to get pregnant, as they can in women closer or after the menopause. So ladies, remember, size alone is not the only factor guiding you in fibroids treatment, but now you know what methods could best treat a specific size of fibroids. Hopefully your choice will be a little bit easier. Thank you for watching. Let me know if you found this video helpful. Give it a big like and don't forget to subscribe to the channel. Please use the link in the description box to reach me if you have any specific questions you want answering around fibroids. Have a great day and I'll see you again soon.